So, Dr. Kloiber, what do you think in the world can we make difference between the developed and developing countries in this field? I mean, the relation between doctor and patient, does it depends on how is the living standard or the mentality, the culture?
Well, yeah, we should not forget we are living here in a very rich part of this world. In this part of the world, we have a relation between population and physicians which is around 500 or even smaller to 1, which means 500 people of population to 1 physician. And in most of the countries of the European Union, this is even better, coming up to 250 to 1. When we look to some parts of Africa, this goes down to 50,000 to 1, which means there's this for 200-fold lower concentration, so to speak, of physicians there. And that, of course, means that many people in this world don't even have a chance to see a doctor, not to speak about having a patient-physician relationship at all. When it comes to this relationship, so when patients seek the help of physicians, that is very much the same whether you're in a rich country or whether you're in a poor country, because those people come because they are ill, because they are sick, because they have sorrows, problems, pain, they are suffering from something, they have fear. And that is what determines their relationship very much to the physicians from whom they want to have advice and help. And that is very important. It is also important to stress this because many people believe that this is a client-merchant relationship. It is not. It is a very special relationship where the person who comes really is in need and needs help and needs protection. And therefore we see the role of the physicians more as an advocate for the patient, to help the patient to deal with the sickness and illness by healing, by supporting, sometimes just by helping them mentally to come over the problems there.
So we can say also that the differences between salaries, for example, in developing countries, the doctors have lower salaries, so maybe the behavior of the doctors is different too in different fields of the world.
The behavior is sometimes compromised by the fact that, for instance, if you have a relationship between population and physician of 250 to 1, you simply have much more time for your patient than you have 50,000 to 1. So if you are sitting in a clinic in Ghana, in the North Volta region of Ghana, where there are 500 people sitting there and waiting for your help every day, this is certainly different than when you are in a clinic in my hometown in Cologne and you have 20 people a day you have to look for. So that certainly makes a big difference in there. But I would not say that the attitude of the physician is a different one, because they are there to help their patients and that's what they try. Yes, there's another difference. The difference is if you do this in my home country, in my hometown in Cologne, you have an ample range of things you can offer and you can discuss with your patients what you do as a treatment. If you are sitting there in Ghana or Nigeria in a rural area, you probably have not very much of options what you can offer, and sometimes it's really nothing than just talking to the patient and helping them spiritually there.
Thank you.